The first step leg bath has been conceived and invented by Maureen Scott, a nurse based at North Tyneside Primary Care Trust, in collaboration with MDTi. It was developed out of the need for a more satisfactory way for community care nurses to bathe ulcerated leg wounds during home visits. With many wounds requiring up to 20 minutes bathing once or twice a day, the process can become time-consuming and difficult, particularly if a purpose-built plumbed-in water bath is not available. The process is further complicated when dealing with patients suffering from limited mobility, general frailness, and in some cases, obesity. Traditionally, buckets and washing up bowls have been used to bathe leg wounds. However, patients with reduced mobility often have difficulty raising their leg into and out of the bucket or bowl. The size of the bucket or bowl may mean that the patient's feet are a tight fit and there is limited room around the feet and legs to wash the area. This can cause risks to patients if the limb is frail and to the nurse when the limb is heavy due to obesity and edema. This situation created a need to develop a device enabling nurses to bathe the patient's foot or feet without the need to lift their leg up into and out of the bathing receptacle. The device also needed to be safe to use and promote best practice. The result is a simple to assemble leg bath that lowers to the ground, enabling the patient to easily place their feet into the bath. The bath is then raised up around the leg. The new portable first step leg bath addresses the limitations of the current procedure and provides a method of treatment which is both comfortable for the patient and easy to use by community care nurses in the patient's own home or clinic settings. Ensure your patient is sitting in a comfortable position before explaining how the leg bath works. Place the metal base next to the patient's foot, ensuring that the curved end is pointing towards the patient. Now place the centre pole into the metal base and secure with the pin. Slot the leg bath's bag holder over the pole and lower to the base. Place a disposable bag liner into the purple bag. Ask the patient to place their foot into the bag and gently raise the frame to the required height. This can then be secured using the pin provided. Using the bucket allocated for clean water, fill the leg bath to the required level. Bathe the patient's leg as necessary. When the bathing is complete, empty the contents of the leg bath into the dirty water bucket using the handheld siphon filter. This is operated by placing the grey pronged end into the water and then holding down the red button until the leg bath is empty. When emptied, take out the pin and gently lower the frame. Ask the patient to take their foot out and carefully dry it with a towel. Remove the disposable bag liner and discard. The leg bath can then be dismantled, cleaned and stored as per instructions. The first step leg bath, invented by a community nurse, improves the delivery of care and makes the healthcare environment safer for patients, nurses and carers. This simple yet practical innovation not only demonstrates how inventive people in the NHS can be, but also their desire to improve healthcare. These sort of practical advances can only happen if NHS staff have the confidence to voice their good ideas. Those good ideas receive active, enthusiastic, professional support provided by NHS innovations teams, and the NHS collaborates with capable commercial partners, such as MDTi.